This podcast contains discussions on sexual misconduct. Topics such as sexual exploitation, abuse, and harassment may be discussed. Listener discretion is advised.
We want our program at all levels to enjoy the highest levels of acceptance, confidence, and trust, which means that both personally and professionally, we have to display the highest standards possible. And that's ultimately engendering respect in the communities and the households that we're seeking to serve.
In this episode, I speak to Aidan O'Leary, Director for Polio Eradication at WHO. He explains how the path to eradicating polio can hold risks of sexual misconduct in the aid sector. He emphasizes on the importance of leadership, on upholding professional standards when representing the organization.
If you don't feel that you're ready to actually walk the talk in terms of the standards, for whatever reason, then it's important that you don't go.
This is the #NoExcuse podcast, discussing the challenges, complexities, and potential solutions in preventing and responding to sexual exploitation, abuse, and harassment in the aid sector, through interviews with victims and survivors, experts, aid workers, artists, and leaders. The podcast is produced by the World Health Organization's Department for the Prevention and Response to Sexual Misconduct. I am Guni Dias, your host and global focal point for the department. Welcome, Aidan O'Leary, to the #NoExcuse podcast.
Good afternoon, Guni. Many thanks for the opportunity and delighted to be with you today.
So you've been, since the establishment of this department of the prevention and response to sexual misconduct, a champion of this work. So it's really nice to have you on the podcast.
For me, I think I've always been delighted to help and support in any way that I can. I think it's a critical topic for all of the organizations that I've worked for. I think it's particularly important for an organization like WHO, and anything that I can do to assist and support to try and make sure we get it right, I'll always be happy to support in every way that I can.
You play a very important role in global public health, which is leading WHO's work towards the ambitious goal of polio eradication. Since 1988's World Health Assembly's resolution to eradicate polio from our planet, while poliovirus cases have decreased by over 99%. As WHO's director for polio eradication, why is the subject of, like sexual misconduct, important to you?
So firstly, I'm very privileged to be involved in the polio eradication program. As you've highlighted, it has an extraordinarily ambitious goal, is to make sure that no child anywhere in the world is at the risk of paralysis. And as you've highlighted, we've made considerable progress. So from a situation of 350,000 wild polio cases a year in 1988 to a handful of cases in just two endemic countries, Afghanistan and Pakistan at this point in time. So clearly a lot of progress made, but polio eradication is a zero-sum game. And the importance for polio is to reach every child, no matter where they are. And as we get closer and closer to the end game, that brings us essentially to those countries that are impacted by, or what are categorized as protracted complex emergencies, either for reasons of conflict, climate events, but that invariably means high levels of displacement, usually are high levels of conflict, inaccessibility, insecurity, and as a result, basic human systems, whether it's health, whether it's food security, nutrition, all of those tend to be highly challenged. So for the work that we do, we have to go house to house to make sure we reach every child under 5. And as we've progressed our work, most of what we do, and we vaccinated almost 900 million children across the globe last year, most of these operations were concentrated in areas that are subject to these protracted complex emergencies. So there's a range of different challenges that have to be worked through. For me, when we go house to house, the single most important interaction is the knock by a frontline vaccinator on the door of a household, seeking to access, engage with parents and caregivers to make sure we're able to vaccinate and protect their children. Mm-hmm. That can only happen if there's acceptance, confidence, and trust. So if you're not accepted, if there's no confidence in the work, if there's no trust in who you are, then you will simply not have access to the children that we need to access. And as we know, the children who are most at risk are usually those who are 2 years and below, who are rarely allowed outside the home. So it's really important that we have the confidence to enter the home. Issues such as our sexual abuse, exploitation, ultimately it's an abuse of authority against populations that are at high risk, highly vulnerable. For us, it's simply not a sustainable approach. So for us as a program, clearly the approach has to be is that we want our frontline staff, we want our program at all levels to enjoy the highest levels of acceptance, confidence, and trust, which means that both personally and professionally, we have to display the highest standards possible. And that's ultimately engendering respect in the communities and the households that we're seeking to serve. So for us, this is not an optional extra. This is something that is absolutely critical to delivering on the goals that we do. I've mentioned that we're doing hundreds of millions of vaccinations every year. We work with a workforce, in countries that run into either the hundreds of thousands, but overall there's millions of frontline vaccinators that work with the program during the course of any year. Making sure that we succeed in every opportunity is fundamentally what we're trying to make happen, because it's absolutely essential to deliver the goals we're seeking to achieve.
What is your team and the partners on the ground doing to mitigate risks of sexual misconduct by our workforce and our partners as well?
So I think, firstly, or as with most partnerships, it's ultimately built in a recognition that no one agency can do this alone. And I think as the Global Polio Eradication Initiative, it's a highly effective public-private partnership that brings together WHO, UNICEF, the Bill and Melinda Gates Foundation, Gavi, the US Center for Disease Control, and Rotary International, which was basically the genesis of the idea of eradication in the first instance. And I think there's a very clear recognition on our side in terms of articulating what the expectations are. And the articulation, or shall I say, really is that there's no place for these behaviors anywhere in the program. So when we speak to whether it's the global level, whether it's the regional level, whether it's at the country level, it's essentially reinforcing those messages and really making sure that while each individual partner may have its own distinct or approaches, mechanisms, and so on, it's all geared towards the same goal. And I think for WHO, it's clearly around making sure awareness raising, at all levels. The sensitization is ongoing, really to make sure that, this issue is not something, as I say, that's an optional extra or is a la carte. This is an essential part of how we do our business. When we talk about training sessions to sensitize in terms of how we do our work, this is obviously an important element for discussion to really make sure that when it comes to frontline delivery, to make sure that we're able to recruit and retain the people that we really need to deliver the program that we need to deliver. These are the standards that the people who work for us or who work with us know are the absolute minimum that needs to be delivered. Sometimes when we're in a crisis, so in the immediate aftermath of our events in DRC, clearly there's a very, very sharp focus overall. You're almost in what I would call a crisis mode to address issues that are involved. But this is not just a crisis piece. The real commitment is to make sure that we work towards prevention, not response. So that means that it's making sure and reinforcing that expectation that at all levels of the program, and it's all levels of the program, we do display the highest personal and professional standards in terms of how we go about the work that we need to do.
You're quite known for your excellent management skills in leading the polio program, but also in your past experiences. For managers who are uncomfortable with the subject of sexual misconduct or are unfamiliar with the prevention and response aspect of the work, what would you advise them?
Firstly, I'm not so sure about the excellent management skills. I think it's more a question of learning by doing. And very simply, if you don't make mistakes along the way, you're actually not progressing. But I do think the important thing is that over many years, I have kind of accumulated quite a lot of experience. And I think that the first thing is to be really clear. So whether you're working at a headquarters, but particularly when you're working in country situations, either at a capital level or, most importantly, at the deep field levels where the operations are invariably most intense, we need to be clear about what we're walking into. So protracted complex emergencies means that it's a real high-intensity operation. Mm-hmm. It can be stressful. It can be difficult. And you have to prepare yourself both professionally and personally, no matter what level you're engaged in, but particularly if you're getting involved in a leadership role, you need to be clear about basically walking the talk in terms of the standards that are expected. And, if you don't feel that you're ready to actually walk the talk in terms of the standards, for whatever reason, then it's important that you don't go. Because these emergency operational environments tend to be extremely demanding. Mm-hmm. So it can be 24/7 and it can go for quite extended periods of time. And you have to have a mindset that in terms of what's necessary to make this work, whether it's for your program, in terms of the team dynamics, in terms of the partnerships that you have at country level, you have to be basically walking the talk in that regard. And people are well able to see whether that is the case or not. And you have to really exemplify the values that you're hoping to project whilst delivering the programs. And to be very clear, I don't believe you can actually deliver the programs if you actually don't display the values that are necessary to make that happen.
You're talking about leadership. Say we are in an organization where we have experts. How can we hone that ability to lead a team like that?
I guess for me, I think I've mentioned the term learning by doing. So I've learned from many, many excellent country colleagues over the best part of 20 years. And that has usually been in conflict settings. And the experiences and the memories that have always stood out are, this working with top-class people. And top-class people tend to be very good both in terms of their professional and their program work, but also in terms of how they maintain their own personal standards and how they engage with teams. And for me, the question mark is that it all starts with you being as kind of self-aware and perhaps as self-critical as needed to be, but be motivated in the right way to improve yourself both personally and professionally. For me, there's no simple answer on that. In every field operation in which I've worked, I've come across top-class international and national professionals who've done outstanding work in extraordinary challenging circumstances. But they're respected by their peers, both inside the organization, outside the organization, because people recognize who they are, what they do, and all of the various different challenges that have to be navigated day in, day out, week in, week out, to deliver the type of excellent work that they do. And I think it's to recognize that across many of our organizations, and certainly many of the teams I've come across in my time in WHO, we have outstanding people. What we need to have is to make sure that we turn everybody, kind of motivated towards the achievement of those type of standards. And that's an ongoing work in progress to which I think we all are and should be committed towards doing.
As you mentioned, your career has spanned several conflict zones, high-risk stakes environment like Yemen, Iraq, Syria, especially in emergency. Reflecting on your time in the field and as a man, away from your wife and children, how do you manage that?
Firstly, I think the important thing to say is that I'm very, very lucky to be supported in the way that I am by my wife, Karen, but also by or my two children, Dara and Emer. And I think what is really important in terms of the type of roles, I have been working in these kind of settings for the best part of 20 years. It's not simple. It's not straightforward. And I think what it does require, as I've mentioned, is at a personal level, we need to be clear about what the expectation is. So whether you're working in a place like the Gaza Strip or Afghanistan or into the Syrias, the Iraqs and the Yemens, these situations are really intense. The circumstances are extremely difficult, and you have to recognize that when you're going to work there, you're going to be working very, very intensely. To do that, you need to be very clear about being right physically and mentally, and being aware of what the expectations of you are as a leader, because you're the person who's going to have to drive the standards and the expectations for your own organization, but you're also going to be representing your organization with communities, with non-state actors, with governments, with partners. And, the bottom line is that you really have to are kind of motivated with the intent to go and do that. Mm-hmm. If you're not prepared to do that, in my view, you're better not to go, because ultimately these are not the places where we can have people who are not of that mindset, because we'll never achieve the goals that we've set out to do. And in all of these locations, what the communities in dire need actually are is assistance and support. Mm-hmm. That's why we're going. That's why we have to be there. They need that support. They want it delivered effectively and efficiently. And we have to have the mindset that actually the overriding reason that we're going there is to deliver that. But on a personal level, my experience has been it's really important to have that communication on the family side, to have the support from the family side. If there are issues and problems, then we need to speak about those issues in advance. There's nothing worse than kind of hearing about whether it's bad news, difficult news after the event. The sooner, the better. And certainly in my engagement with teams on the ground, there are always going to be issues. Mm-hmm. So having good communications with teams, with partners across the board, you have to be available for that to make it work. And in my experience, and again, I've learned from ideal mentors and role models over the years, good communication, consistent communication, responsive communication is an absolute essential part. But it's not just on the leadership, it's at all levels. Everybody has a role to play on this, because we have to be very, very clear about what the overarching objective is, which is to assist communities that are really in very dire circumstances. So we have to put a lot of other considerations to one side to really make sure that we serve that overarching goal.
So you mentioned personal accountability in this work, and understanding that you're part of the solution. What would you say about the organization's accountability in enabling an environment that fosters prevention of sexual misconduct?
So I think there's maybe two things. So I think there's obviously policies and frameworks. Mm-hmm. There's then practices. But for me, the issue has always been people. Yeah. People set standards in practice. So when invariably you get the right people into the right places, whether it's in relation to program work, whether it's in relation to team dynamics, whether it's in relation to our kind of good working relationships and so on, people set the standards, people set the tone, people drive the dynamics. And that's why I think, the most important piece all the time is getting the right people into the right places and recognizing that, getting the very best people we can into the most difficult places is, kind of what we ultimately need to be doing. I recognize there's difficulties with that. It's not always possible for people to go, but that's why I think that self-awareness, mm-hmm. that self-understanding about what people are able to do and what they're not able to do at a point in time is so critical. So going into a difficult operating environment when maybe you're not personally ready or sorted and so on, then it's not the time to go and do that. But as I say, for leadership in particular, I've worked with OCHA, with UNRWA, with UNICEF. I've seen agencies from both the coordination side, the program delivery side. There's some brilliant people out there. And, what we really want to do is to develop that momentum towards building further on that, but also really strongly discouraging, kind of abusive relationships, abusive authority, because it's not good towards what we have to do in country in terms of team dynamics, and we ultimately don't achieve the outcomes that we want to achieve. Because if people are not motivated, if people are not engaged, if people are not committed, we're simply not going to get there. So it's not easy. It's not straightforward, but we have to continue to work at that and to recognize that at every stage, everybody continues learning by doing. But if we have the right mindset to make that work, we can certainly make that work.
We spoke about sexual exploitation abuse in programs where we have access and exposure to communities. What would you say for people who are not necessarily on the field and in the field and is in the office at headquarters or in the regional offices, where they don't necessarily have a community-facing operation, but there's more risks of sexual harassment? What would you say to that?
For me, the message is basically the same. So, I mean, the personal and professional standards and expectations that exist are clear-cut. We have a very clear role and job to do. Working, kind of as an individual, contributing as you're expected to contribute. That's really important towards a team dynamic, and really encouraging those behaviors is very, very important. Again, I think for me, the key issue is ongoing communication. So kind of being really clear about where the issues are, if there are problems, surfacing them, talking them through, addressing them in as upfront a way as we can. But the bottom line is that no matter where you are, the nature of human relationships are such that there's always going to be a risk of abuse of authority, and that obviously entails potential sexual abuse and exploitation as well. So for me, the question mark is the modus operandi is the same. I think it may not have the same intensity as what I would call the kind of frontline operations, particularly in protracted complex emergencies, but the basic principles are the same. And, for me, I work as the director of the program. The accountability chain for this is very, very clear through the WHO representatives in country, the regional directors, to ultimately the Director General. And it behoves everybody to play their role to make sure that what is the individual expectation, what is the team expectation, what is the team standard, that's actually are achieved and met. And we continue to work to make sure that that maintains and remains the case.
And to close off, we always like to talk about self-care. So you've gone to very high conflict areas. Well, how do you manage your personal well-being?
This is obviously, it varies kind of country setup by country setup. As I mentioned, I think earlier on, I think having the right mindset from the outset is really important. I think it takes a while to understand the team dynamics, both within your own organization and with our partners on the ground. Invariably, you'll find that you strike up, good relationships with some or more than others. I think it's important to recognize, because of particularly the non-family hardship duty stations, you tend to be working your full cycle, whether it's 4, 6, or 8 weeks, pretty intensively. My own experience is that, I would always like to spend downtime, with either people from my own team or people from partner agencies, people from elsewhere. Physical fitness was always an important part for me. I managed to do I think a half marathon in Sana, running inside the compound at one point. But the thing is, it will vary location by location. But for me, the question mark is, the work is the work. That's why we're there. But there's some really good people working within our own organization, working with partner organizations. You invariably work to kind of, meet, socialize, discuss with them. But I think, the issue of, for me, certainly kind of running was a very useful way of, kind of maintaining my own physical welfare. But I think, particularly in the hardships duty stations, taking the R&R cycle when it comes is really important.
Sorry to interrupt you. For those who don't know what R&R means.
So these are your rest and recuperation periods. So if you have a 4-week cycle, you work in the duty station, usually pretty intensely for a 4-week period, and then you have a 1-week break. Sometimes the duty stations are for 6 weeks, sometimes they're for 8 weeks. But whatever they are, for me, what was really important is that, we're very lucky that communications have advanced, certainly from where they were in the 80s and 90s. I've always been able to communicate with my family more or less on a daily basis. And then when I take my R&R break, then that's clearly family time. And so, there's much to do in terms of family activities, our family events, extended family events, but trying to make sure you get the right balance on that, I think, is really important. But those communication lines, absolutely critical. And touching in, everything going okay. Is it ideal? Is it the norm? I don't know what the norm is anymore. But for me, the important thing is that you have those open lines of communication, and that continues to work. And you spend the family time when you can spend that family time. So for me, I've been very fortunate that it's actually worked out for me. But it's really important that individually, we're very, very clear about what's needed to keep both those personal and then those professional relationships going in the right way through those kind of periods. So for me, as I say, the standard and expectation is clear. The challenge is individually to do that. And, with your own team also being really sure that people are taking the time off. Because these places, as I say, are not easy. It's important that people do get the breaks. And then we make sure that, when we're in country and doing the work that needs to be done, we're actually fully focused on making that happen.
Thank you so much for joining us. You've given us a focus and an emphasis on personal and leadership accountability. And I think that's it's a message that I think we can hold quite close to us, and it's a very achievable advice. So thank you, Aidan, for joining us and sharing your wisdom.
So many thanks again for the opportunity, Guni. Take care.
Thank you for listening. If you have any feedback or questions, feel free to reach out to us at prseah@who.int. Until the next time, goodbye.